Hello again, and thank you for joining us for today's webinar on navigating youth crime, violence, and behavioral health. We are joined with Josh Weber. He is our Deputy Division Director over our Juvenile Justice portfolio here at the Council of State Governments Justice Center. And before he comes on, I just wanted to come on and say, let everyone know that we will be recording this session today. It will be available on our website, and we will make sure to send that link to you once it's available later this week. And that also the last 10 minutes of today's session will be reserved for questions and answers. So if you would, at any point during the presentation today, just put your questions in the question and answers box at the bottom or in the chat. I'll make sure to monitor that. And when it's Q&A time, we'll relay those questions to Josh for him to answer. And so with that, I will pass it over to Josh Weber. Thank you all.
Thank you, Keisha. Good afternoon, everyone. Thank you for joining. I'm Josh Weber. I oversee the Juvenile Justice Program at the Council of State Governments Justice Center. For those of you who are unfamiliar with the Justice Center, we are a national nonprofit, nonpartisan organization. We work with all branches of state government as well as local government to help them improve outcomes for youth and adults in the justice system through data-driven, evidence-based strategies. Through our juvenile justice work, we have worked with states and counties all across the country to help them assess their juvenile justice systems in alignment with what research and best practices say works to reduce recidivism and improve other youth outcomes. And we've helped many states to revamp their system through legislative, administrative, fiscal, and other system reforms. We also conduct original research and identify challenges and barriers to improving outcomes for young people in the juvenile justice system, and continuously create reports, infographics, and other tools and resources for juvenile justice professionals and state leaders to help them improve outcomes for youth. I have been at the Justice Center for over a decade, and I think it's fair to say that this has been the most challenging time that I've ever seen to improving outcomes for youth in the juvenile justice system. Concerns about youth crime and youth violence are at a level really not seen since the super predator era of the mid-90s. We've seen a number of states pass regressive policies and practices that push more young people into the juvenile justice system and can lead to more detention and incarceration and transfers to the adult system. So we spent really the last year analyzing the most recent data available, which admittedly is lagged, but to try to understand what is actually happening with juvenile crime and juvenile violence. Has there been a significant increase in crime and violence? What are the challenges that young people are experiencing? To really educate state policymakers, system leaders, and others about how best to respond to this moment and how to stay committed to research-based policies and practices. And based on that analysis, there are 3 facts that we think everyone should know around this issue, as well as 3 strategies that states and locales should be looking to employ. So the first fact to know is that it's important to really look at the root causes of youth crime and violence and the challenges that young people are experiencing. And one of those key root causes is that adolescents are increasingly struggling with a host of mental health, substance abuse, school, and other challenges that can impact their well-being. And ultimately, if that behavior is not addressed and it can escalate, poses a risk to themselves, to their family, or to public safety. And at the same time, public systems and service providers are really struggling to address these needs. So first, adolescents are experiencing unprecedented mental health challenges. These mental health challenges have been accelerated by the COVID-19 pandemic, but started before the pandemic. So in 2021, and this is based on the Youth Risk and Behavioral Health Surveillance System Survey, which is conducted by the Center for Disease Control, 29% of high school students reported that their mental health was most of the time or always not good. And over 40% of all high school students nationwide, including 56% of girls, as well as up to 70% of LGBTQ plus youth, reported that they felt sad or hopeless on a regular basis. And that's compared to 26% in 2009. The proportion of high school students who seriously attempted suicide has risen steadily. In 2009, it was 14% of high school students contemplating suicide, and in 2021, that number rose to over 22%. And for high school students, tobacco, alcohol, and substance use has been declining over the last decade, but overdose deaths, particularly due to opioids, spiked during the pandemic and remained elevated into 2022. And so really, the last decade has seen a rise in adolescent loneliness and anxiety and depression that places these young people, and particularly females and LGBTQ youth, at risk for a variety of challenges, including system involvement. And it's important to look not just at adolescent mental health, but trauma. And again, adolescents at high risk of trauma, not just during the pandemic, but really started before the pandemic and after the pandemic. But again, in 2021, based on national data, 55% of adolescents reported experiencing emotional abuse by a parent or adult in the home, and 12% reported physical abuse by a family member. 20% of high school students reported ever seeing someone get physically attacked, beaten, stabbed, or shot in their neighborhood, and that included almost 1 in 3 Black students. So family trauma, community trauma. Over 11% of all high school students said that they experienced sexual violence by anyone, including almost 20% of girls. And over a third of all high school students said that they experienced racism, including over half of Black, Asian, and mixed race students. So you can see that in addition to the mental health and substance use challenges, adolescents are dealing with potential trauma at home, trauma in their communities, trauma from their peers. And we know from the research is up to 2/3 of young people who will become involved in the juvenile justice system have a mental health or substance use issue. And so these issues, if unaddressed, are more likely to push youth into the juvenile justice system. At the same time, states have historically lacked any kind of formal system for prevention or behavioral health services statewide to address these challenges. It's very hard to measure the availability and the prevalence of behavioral health services on a state level, let alone at the local level. But when we work with states and counties, perhaps the #1 challenge that they cite to improving outcomes for youth in the juvenile justice system is the lack of behavioral health services. By at least one measure, over 5 million young people in 2022 had at least one major depressive episode. Less than 50% of those youth received mental health services. Approximately 3 million young people had a severe major depression episode annually, and only a little more than 50% of those young people with severe mental major depression episodes actually received consistent treatment. So the availability of services historically and right now to really meet these rising mental health challenges and other needs is very low. At the same time, this has really gotten worse since the pandemic. Public agencies are really facing an unprecedented staff hiring and retention challenge that's undermining their ability to help address youth needs. We did a national survey of juvenile justice agencies last year to try to understand the extent of their hiring and retention challenges. And more than 85% of public agencies, this includes juvenile correctional agencies, probation agencies, detention agencies, said that they were facing moderate to severe challenges in hiring and retaining staff. 55% reported that those hiring and retention challenges were more severe than any time in the past 5 or 10 years. And this was the response that struck me the most in this survey, is the majority of respondents, when asked, said that their state leaders, that policymakers were aware of the staffing challenges, were aware of all of the operational issues that they were facing as a result of not being able to staff and retain staff, but less than 10% of respondents felt that their state actually had a plan to address these staffing challenges. And that was reinforced by, we conducted listening sessions with agencies across the country, and they described really not knowing what to do in the face of these challenges, the way the nature of work has changed since the pandemic, inflation and the salaries being offered to not just juvenile justice professionals, but child welfare professionals, behavioral health professionals, not competitive with other industries, and especially given the challenges of the job and having to work with the most complex and challenging adolescents statewide, that really an absence of systemic strategies to address these staffing challenges. At the same time, schools have traditionally been a critical outlet to identify young people who have special needs, including potentially mental health, substance use, or learning challenges, and to provide support. But also, as a result of the pandemic, absenteeism, school absenteeism has surged. Absenteeism is defined as missing 10% or more of the school year. And you can see from this data that absenteeism has always been high, even in 2018. But since the pandemic and post-pandemic, national absenteeism rates are about 28%. And you can see that those are higher for schools that are lower achieving schools, which are typically in poorer communities. So over 1 in 3 young people attending a lower achieving school chronically absent, missing more than 10% of the school year. And so besides the fact that that means that they're not getting the education they need, not around positive teachers and adults, which we know is also a risk factor for juvenile justice system involvement, it means schools don't have the opportunity as much to identify students who are struggling and who may need behavioral health or other kinds of services. Also, in the survey that we conducted, we asked about service providers, and both based on that survey and through listening sessions, there's not just a public agency staffing crisis, but there is a service provider staffing crisis. In the survey that we conducted, more than 85% of public agencies reported that their service providers were experiencing moderate to severe staffing challenges. And more than 80% reported that those staffing challenges were having a moderate to severe impact on service availability. And as we work with states around the country, we hear this over and over again, that in many communities, particularly in rural communities, there simply aren't enough services or service providers. In other areas, particularly in larger cities, there may be more services, but there are not enough staff to provide those services. Vacancy rates as high as 50 or 60%, public agency resources going unspent, RFPs not being responded to. And so a significant challenge to really build up service provider capacity to meet these needs. And as a consequence, many young people are pushed into the juvenile justice system, not because they're a public safety risk, but in order to obtain needed services. Second key finding from our data analysis is that youth arrests for violent offenses actually remain historically low, despite the concerns and the rhetoric and the media coverage around violence. But at the same time, post-pandemic, there has been a specific surge in homicide and weapons offenses. So first, and this is really important, historically, the arrests for youth violence declined 54% from 2000 to 2022. And you can see, other than a sharp decline during the pandemic when kids and adults and no one was being arrested for anything and people were on lockdown, overall rates of youth being arrested for violent offenses, and violent offenses include rape, robbery, aggravated assault, and homicide, were lower in 2022, and 2022 is the most recent year we have data available, were lower in 2022 than any time in the past 22 years. So overall, this narrative that youth violence has exploded, that young people are kind of going crazy around the country, overall in terms of violence is not actually true. And you can see here, when we look at more specific offenses, aggravated assault, rape, robbery, all in 22 remained historically low, basically at their lowest point in 22 years, other than the artificial lows of the pandemic in 2019. At the same time, we do have to acknowledge that homicides committed by young people and arrests for homicides have been increasing for a decade. Most of those homicides are due to gun violence, and as you can see from the chart, very much surged during the pandemic. And so while violence overall is low, and obviously homicides are generally a low prevalence event, they have been slowly increasing for the last decade and then significantly accelerated during and after the pandemic. That coincides with also a significant surge in weapons offenses. So you can see weapons offenses generally been declining over the last 2 decades, but specifically in 2022, post-pandemic, a surge in weapons offenses, and these two trends have gone together, most of those weapons offenses being gun offenses, and unfortunately many of those guns being used in homicides. And so as a result of this spike, homicide and suicide, primarily due to guns, is now the single largest cause of death among children and young adults. You can see from the chart, homicide rates really since 2013 have steadily increased, a little bit of a dip, and then increased again post-pandemic. And homicide rates have been steadily increasing. That is disproportionately impacting youth of color. So in 2022, the rate of firearm deaths among Black youth was 22 times higher than it was for white youth. The rate of gun violence in rural areas is now equivalent to the rate in urban areas for Black youth. And that much of this violence and these deaths were peer-to-peer violence. So in 2022, in half of all cases in which a young person under 18 committed a violent offense, the victim was also under 18. The good news is, as I mentioned, data is lagged, and we still don't have complete FBI data for 2023, let alone 2024. But the data that we do have and the estimates that we do have, we don't have it specifically for young people, but we do have it combined for youth and adults, shows that just as there were historically large increases in gun violence and murder in 2022, there was just as large historical declines in murder and gun violence in 2023 and 2024. So regardless, it's important that gun violence and youth violence should be a policy priority. Policymakers should take violence and violence prevention seriously. But what this data shows is potentially there was a moment in time during the pandemic and post-pandemic where violence spiked. The same thing happened for young people as happened for adults, but evidence suggests that that is subsiding. And so rather than overreacting to a relatively short-term data blip in violence, it's important to really try to understand some of the root causes of that violence, like behavioral health issues, community challenges, family challenges, and address those. The third key finding is, given the importance of youth violence, but its relatively low prevalence, the juvenile justice system should really focus its limited resources from a public safety perspective on youth who have committed or at high risk of committing those more serious and violent offenses. Yet that's not actually what the data says. What the data shows is that despite the juvenile justice system having shrunk over the last 2 decades, most youth who become involved in the juvenile justice system have committed offenses that don't involve physical harm to another person. So the research is really clear that diversion is, for most youth, a more effective public safety strategy than formal juvenile justice system processing. There are a variety of research studies that have shown that, the most powerful of which is the Crossroads study that tracked similar groups of young people across over a 5-year period and compared the difference between diversion and formal arrest and court involvement and system processing for those two groups, matching those two groups so they looked similar in terms of their risk, needs, and offense profile. And what that research found is that youth who are formally processed by the juvenile justice system were more likely over a 5-year period to be rearrested, more likely to be incarcerated, more likely to engage in violence, more likely to have peers who were involved in other delinquent offenses, had lower high school graduation rates and school completion rates, had fewer skills to manage their emotions, and felt less optimistic about their future than youth who were diverted. And so really, this research reinforces that we should focus the juvenile justice system's time and resources on that smaller number of youth who commit or are at risk of committing more serious offenses, and divert other youth to more prevention services outside of the juvenile justice system to address their needs. And on the surface, you might think that that has been what's happening, because over the last 22 years, we've seen consistent declines to the point of a 70% decline over the last 2 decades in the number of youth who are arrested, the number of youth referred to court, detained, and incarcerated. But while the number of youth coming into the system has been significantly reduced, the type of youth being served by the system hasn't changed nearly enough. And so what this chart shows is for 2021 or 2022, the most recent data available, at each point in the juvenile justice system, the percentage of young people involved at that point in the system whose most serious offense was a non-person offense. So, for example, in 2022, 70% of all youth who were arrested had committed a non-person offense, an offense that did not involve physical harm to another person. Often these arrests still are for status offenses like truancy or curfew violations, more discretionary offenses like disorderly conduct, young people still being arrested for low-level drug offenses. And so 70% of the young people being arrested did not commit a person offense. 63% of youth being referred to court had not committed a person offense. And down the line, at every point of the juvenile justice continuum, including about 2/3 of young people on probation, their most serious offense was a non-person offense. And this is, even during a pandemic, 56% of all youth who were detained and over 60% of all youth who were incarcerated post-disposition had committed an offense that was not a person offense. And that disproportionately impacts young people of color. So similarly, the number of young people coming into the system has declined, but the population, the relatively low-risk nature of the population being served by the system has not changed nearly as dramatically. And racial disparities generally have not changed. They've gotten a little better for Latino youth, but have gotten consistently worse for Black youth as well as American Indian youth. And so this chart shows relative rate index comparisons between 2005 and 2020 or 2021. And that is the rate at which Black youth are involved in the system compared to white youth. So, for example, in 2005, Black youth were arrested almost twice as more at the rate of their population than white youth. In 2021, that increased to 2.5 times as likely to be arrested than white youth. And you can see at every point in the system, at arrest, at court referral, being adjudicated, and then those disparities become most pronounced at the point of out-of-home placement. In 2021, Black youth almost 5 times more likely than white youth to be detained, and almost 6 times more likely than white youth to be placed post-disposition out of home. And this is one of the findings from the analysis that struck me the most, and as I said, I've been doing this work for a long time. But when you look at what happens to kids who are being referred to the juvenile justice system and being referred to court, the rate at which those young people are adjudicated has been steadily declining, so that in 2021, less than 30% of all youth who were referred to the juvenile justice system actually were adjudicated. And given the racial disparities involved with referring kids, arresting them and referring them to court, given the collateral consequences and the harm caused potentially for referring young people to court compared to diversion, given the time and expense for attorneys, for judges, for young people, for families, with many states still having court fines and fees, the question is, what is the public safety benefits and the efficiency of referring youth to court in the first place when less than 1 in 3 of them actually get adjudicated? And in fact, if a young person gets their case dismissed or dropped, they may be less likely to get services and supports for the reasons that brought them into the juvenile justice system than if their case never went to court and they were more quickly and efficiently connected to services in the first place. So why this gap and this real feelings amongst many state leaders, amongst the public, that youth crime and violence is out of control when the data really says, yes, there was a spike during the pandemic in gun violence, in homicides, but generally violence is down, arrests are down, and the majority of young people involved in the juvenile justice system are still low risk and have committed less serious offenses? Well, I think there are a couple of reasons, and it's important to think about those reasons because it's not just enough to show data. These reasons have to be addressed as well. So first is there is a difference between victimization and crime and arrests. Most victimization that happens does not actually get reported to the police. Most crimes that get committed don't actually get solved, particularly lower level offenses. And this is true on the youth side as it is on the adult side. And there's some data that suggests that this gap actually widened during the pandemic. And so what people are experiencing in the community in terms of violence or youth crime might not be fully reflected in the crime and arrest data. The second key part of this is every locale is different. So I'm sharing national data, we have state data available, but this looks very different in every local community. And at the local level, often there isn't great data collection, depending on how the numbers are reported. If the numbers are reported compared to the lows of the pandemic, then it's going to look like youth crime and violence is exploding when that's not actually the case. But a very urban area might be experiencing a different kind of reality than a rural community or a suburban community. So just generally, like, we don't have great data on crime and violence. The data is lagged. I can only show you 2022 data, which is the most recent data, and data collection at the local level often isn't great to really understand what's happening. Third, obviously, is media coverage. And research consistently shows that people's perceptions on crime and violence is heavily shaped by media coverage. And we've really seen in the last few years, media kind of, reverting back to the kind of if it bleeds, it leads type of news, particularly around youth crime and youth violence, spending a lot of time showing the outlier cases, the most violent cases, the highest risk youth, even if those don't represent the vast majority of young people. Media also has a bias against covering more positive news and positive trends. So lots of coverage around the spike in violence and homicides, but you don't really hear any coverage on the decline in violence and other types of serious offenses more recently. There's also a more tendency to anchor on extreme cases. And so you may have experienced this in your communities where the young person who does, the unfortunate, really tragic kind of offense or the shooting or the again, very rare cases, but those cases become held up as really examples for the entire system when they don't actually represent the majority of the system. And that feeds, unfortunately, into partisan politics. 5 years ago, 10 years ago, juvenile justice, criminal justice was one of the few bipartisan issues. That's really not the case anymore. At this point, justice has become much more of a wedge issue, and those extreme cases are often held up as evidence that the system is not working when they're not, in fact, representative of the juvenile justice system or larger trends with youth crime and violence. And we also have to admit that sometimes the system isn't performing as effectively as it should. Sometimes state leaders and officials don't know what to do. They don't know what really works to reduce violence. We don't have as many strategies as we'd like that are really proven effective in the real world for working with the highest risk youth. They may not know how to build service provider capacity or address staffing needs. And so that can lead to law enforcement and others feeling like kids are arrested and nothing happens to them, or there are a lack of effective responses. And so right now there's a lot of frustration and uncertainty about how to really address these connected issues of crime, violence, and behavioral health. And it's really important that public systems and agencies have a clear response and really rely on what research shows is most effective. So what does the research say, and how should states be and local communities be responding to this moment? The reason that we put these things together is what we've been seeing is states really implementing kind of one-off, isolated, more siloed responses, is not realizing that concerns around rising adolescent behavioral health and trauma and substance use, that investing resources for behavioral health services but then changing juvenile justice policies to detain and incarcerate more kids are contradictory efforts. We're also seeing more finger pointing across the juvenile justice system, child welfare system, behavioral health system, education system, as resources are tight, as staffing is more challenging. Systems, rather than operating together and developing comprehensive responses, are more working at cross purposes. So we're really trying to use this moment in time to help connect the dots for state and local leaders, to encourage jurisdictions around the country to really take a step back and develop a more comprehensive approach. And that starts with a statewide or jurisdiction-wide, really a prevention strategy around adolescent services and violent prevention that is really not designed not to wait until behavior spirals out of control, but to address the root causes of young people's behavior. And so what would that kind of system look like? So first, it should be jurisdiction-wide. It's not sufficient to just say, more urban, well-resourced communities have services, but looking at an entire state or entire community, it's got to be structural. So a lot of the issue right now is young people with behavioral health issues, without strong families, without access to pro-social services and resources. There's no one entity that's responsible. In most jurisdictions, you have to wait until the behavior becomes serious for young people to get services, and then they become system involved. It's developing a structure that sits outside of any one system, but is still formal and accountable and structured and is cross systems, and is really focused on the outcome of healthier, more young people who aren't having public safety issues, family conflict issues, and self-harm issues. So it's got to be structural, it's got to be cross systems. Second is it's got to be focused on services. We know from the research, and I just shared a bunch of this research, that court involvement by itself does actually more harm than good, that supervision by itself really has no impact on youth recidivism, and that sanctions-based approaches tend to do more harm than good, especially if they're not swift and certain. And so really focusing on what we know from the research does matter, which is what are the services that address young people's dynamic risk factors, their behavioral health needs, their families' needs, and how to create statewide systems and structures that are based around services and not using the court as a service delivery system, particularly for kids of color. Third is that it should be individualized, research-based, and developmentally appropriate and culturally competent. That's a lot of principles rolled into one, but families, young people, they need individualized assessment. They need connections to research-based services. Treating all young people as delinquents or as status offenders or as at-risk youth and just referring them to a bunch of generalized services, research shows is ineffective. Services really need to address young people's individualized needs. It needs to be timely. It needs to be family-oriented. It needs to be oriented around young people's different culture and communities. So really taking a look at the full service system and the full range of interventions and how to have more research-based approaches. Fourth is it needs to be community-based. And that sounds obvious, but one of the byproducts of the service provider gaps and the staffing challenges is more and more jurisdictions are defaulting to residential services. In some communities, there is a cultural default to residential services. If there's more investments in services, those tend to be in more beds. And the research consistently shows that serving youth in the community gets better public safety and other kinds of outcomes. And so really focusing on community-based services, community-based supports, residential programs, whether they are secure facilities or non-secure facilities, should be used really as a last resort only for kids who are a serious public safety risk. Pretty much all other young people should be served in the community. And then finally, fifth principle is that it needs to be youth and family centered. Young people and families need to have co-ownership around designing the services. They need to be engaging and meet young people and families where they are. One of the biggest challenges is actually engaging youth in services and getting them to successfully complete the programs that they're referred to. And so making sure that services are youth and family centered as well. So what is that? What might that look like in practice? Well, it could take a lot of different forms, but just as an example, first is that there's a place for families to go to get help with an adolescent before that behavior spirals out of control. So that could be a statewide network of family resource centers, of assessment centers, but an actual physical place where families who are dealing with a challenging adolescent can go, they can get an assessment, they could get warm handoffs to services. We've done many listening sessions with families that just expressed frustration that there was nowhere for them to get help and that they really had to wait until their child needed hospitalization or got involved in the juvenile justice system before they got services. And at that point, they just wanted to get out of the system. And it's just how many hoops did they have to jump through to no longer be involved in the system. So creating an actual place where young people can go and families can go to get the help that they need. Investing in resources like 988 and hotlines and call response centers that actually have a quick and accessible response. And then, mobile crisis and alternative responders so that police isn't, or the emergency system isn't the default response for families experiencing conflict or an adolescent who's out of control, that there's mobile mental health and substance use services, that there's alternative responses for family conflict. In many systems, family conflict is the #1 or a top referral reason for youth being referred to the juvenile justice system, when some mediation and some conflict assistance could have mitigated young people from being arrested and separated from their families. At the next level down is another set of statewide supports really designed to keep young people from becoming involved in the system or being pushed further into the system. So a statewide system of respite and shelter for those kind of family conflict reasons, for runaways, for young people that just need a cooling off period, short term, less than 30 days, but really could help prevent larger and more deeper system involvement. A set of peer navigators, family members with lived experience, young people with lived experience. The feedback on these kinds of peer support programs and communities where we work is incredibly positive. Having those people with lived experience that can help families figure out where to go to get services, how to navigate public systems can be really critical. Having access to restorative practices. So right now there's a lot of accountability rhetoric when it comes to young people, and we need to hold more young people more accountable. And often that's a very vague notion of accountability. And really the main thing that young people should be accountable for is repairing any harm that's caused to victims or communities. And that doesn't require an arrest or justice system involvement. Research really shows that more direct victim mediation, peace circles, those kinds of more direct opportunities for young people to understand the harm that they've caused and talk that through in a facilitated way can both reduce recidivism and improve victims' satisfaction with the juvenile justice system. And then really a sort of cross-systems approach to prevention. A lot of young people end up in the juvenile justice system because they have a complex array of needs and they're kind of getting punted between one system and another, and no one really wanting to take responsibility. And often the juvenile justice system is the system of last resort. And so really having a structure where the child welfare system, juvenile justice system, behavioral health system, community leaders, those family navigators can help figure out how to support young people and families with complex needs and connect them to the appropriate services. And then at the next level down is having those kinds of community-based programs and practices that we know are effective. And that could be for preventing young people from becoming involved in the system or for youth that are in the system. So that includes cognitive behavioral therapy programs and family therapy programs, things like multisystemic therapy, functional family therapy, trauma-informed CBT, have all good research around preventing recidivism and improving other youth outcomes. A real community-based system of mental health and substance use programs, again, not defaulting to more residential beds and inpatient care, but developing those programs and supports in the community. A violence prevention strategy that relies on street teams or peer teams of violence interrupters. Models like Cure Violence, Operation Ceasefire have shown positive impacts in a number of communities in terms of reducing gun violence. Many jurisdictions don't have any kind of formal violence prevention strategy at all. And again, how to target that small number of young people who are most at risk for violence. And then really relying on credible messengers, especially in the midst of a staffing crisis. Those credible messengers, people with lived experience, can be the most effective advocates and supports for youth and families in crisis to connect them to needed services. Second strategy is to focus the juvenile justice system and its limited resources on the small number of youth who pose a public safety risk. So really pushing states to develop that cross-systems prevention strategy outside of any formal systems for the majority of young people. And then that would allow the juvenile justice system to really focus on recidivism reduction and its public safety mission. And so there should be some key principles and practices that should guide that juvenile justice approach. First is to really scale diversion and deflection. There's, as I mentioned, a lot of research that diversion is a better public safety strategy than juvenile justice involvement. And there are opportunities for most jurisdictions to really scale and expand their diversion efforts and to rethink the footprint of courts. Why are so many young people being referred to court when less than 1 in 3 of them are actually being adjudicated? And we know how drawn out many court processes can be. So really thinking much broader and more comprehensively around diversion and the need to have specific diversion efforts, particularly for youth of color. It can't tackle racial and ethnic disparities unless you have strategies that are specifically designed to reduce racial disparities. Past 2 decades have shown general efforts to improve the juvenile justice system have not worked to reduce those disparities. Disparities for Black and American Indian youth have gotten worse. So there needs to be diversion and deflection efforts that are specifically targeting youth and communities of color. One way to help do that is to use risk and need screening and assessment tools at all major decision points. Those tools can be validated for racial bias and can be more objective and data-driven than professional judgment in making these decisions. Tools for making diversion decisions, detention decisions, predispositional risk assessments. But also, many jurisdictions don't have any kind of need screening tools unless kids end up in detention. And given the data that I shared around adolescent behavioral health, having a mental health screening, having a trauma screening at the front end of the system, not just for kids who are in detention, but really understanding if young people who come into contact with the system have those behavioral health needs and should be diverted specifically for further assessment and behavioral health services outside of the juvenile justice system. Third is really limiting the use of out-of-home placement. We work with a lot of jurisdictions who say that they're having a bed crisis as part of their service provider crisis and staffing crisis. But then when we go in and actually analyze the data of kids who are sitting in detention waiting for placement or kids who are being placed out of home, many of those kids, as I showed in the data, are still lower risk kids, kids who could be more safely served in the community. And so whether that's policies, whether that's administrative practices, whether that's using funding incentives to encourage jurisdictions to really invest in out-of-home placement alternatives, jurisdictions need to get creative around that, and developing that system of more intensive evidence-based alternatives. So family therapy, CBT, respite, shelter, family conflict mediation. Those same prevention services can be used to keep kids out of home placement, and obviously we know can be done so at a fraction of the cost as a residential bed. Fourth, key research-based strategy is to think differently about probation and kids on community supervision, and that's where the majority of kids end up. Since we know that supervision by itself does not lead to reduced recidivism or other outcomes, is really thinking about probation transformation. We put out a toolkit around this 2 years ago to really rethink probation conditions, but to really begin to transform probation to be less about supervision and more about connecting young people to services, to support structures, to skill building, and other resources that can help them more sustainably after probation has ended, to be connected to the services and supports they need so that they don't come back into the system. And then quality assurance and data collection, particularly in this current era, it's critical that jurisdictions can really show policymakers, law enforcement, prosecutors, and others that what they're doing is working. Third and final strategy, and then we'll move to questions, is really this workforce challenge. And resources alone are not sufficient. Having investing in evidence-based programs and support structures are not sufficient if there isn't the workforce to actually staff those services and supports. And so in the short term, that means looking at pay. The people who are doing this work are working with the most complex and challenging adolescents in the community. It is incredibly difficult work. It's often community-based, it's often home-based. So we have to pay people commensurate with that challenge. We have to streamline hiring processes and reduce barriers to employing credible messengers. And we have to create more kinds of incentives, especially for this generation workforce, whether that's more micro-promotional pathways or retention incentives or other things to keep people interested in the long term in this work. And in the longer term, really, I think it's a rethinking of not just the juvenile justice, but kind of the adolescent prevention workforce. Just like we invest in teachers because we understand the importance of their mission, what should really be the skills, the qualification, the experiences, and the compensation for the people that are doing this incredibly complex and difficult work? And how can states and jurisdictions really create a pipeline of people that are interested and have the qualifications to do the work in terms of partnerships with colleges, universities, workforce boards, and others to create an ongoing workforce pipeline? And then finally, building service provider capacity. So really trying to build up a larger pool of providers, trying to diversify that pool of providers with more grassroots organizations, really looking at rates for providers, and do those reimbursement rates or funding rates really incorporate the full challenges and activities necessary to do this work well. Investing more in teleservices, particularly in rural communities, and really developing a cross-system strategy around the workforce and providers. Child welfare, juvenile justice, behavioral health, they're all working with the same providers, and there's a need to really invest in a cross-systems approach to build their capacity. Finally, I just want to highlight the importance of an aggressive communication strategy. Talked about the media, talk about the role in communications. All of this work, the substance of it is incredibly important, but there's more need to let people know about the challenges, the interconnected nature of them, and to use stories and success examples and other ways to really show that this approach is more successful. With that, I see that there's a number of questions in the chat. I'll stop and take some questions. Isha?
Yeah, thanks. So the first question we have is, how do you assist families of youth engaged in negative behaviors that lead to legal involvement and who have also declined all services such as therapy, psychiatry, court alternative, etc.? So if the goal is diversion, how do you address youth who decline services provided?
Yeah, I mean, it's a really good question, and it's often what we hear from families, right? Is that they're frustrated. They've tried a variety of things, nothing has worked, and as a result, things get to a boiling point, and kids are often pushed into the juvenile justice system. There's no easy answer, but I think a couple of things. One is, when we talk about accountability, I think the accountability has to be mutual. Most of the focus on accountability is on young people, but it's not on public systems. And so we fault young people and families for not engaging in services, rather than looking at public systems and saying, are public systems doing things, or could they be doing something better to engage youth and families in services? Is it the right assessment, and did we diagnose young people and their families' needs correctly? Are we referring them to services that are actually accessible, or are there safety concerns or transportation concerns or financial concerns, or are the services across town rather than in their home, and the family, everyone's working during the day? Are the services any good? I mean, I think that's like a reality that we have to do more to acknowledge. Is are the services good? Are the staff good? Because of the staffing crisis, that is even more of a concern, where providers might just be trying to get younger people or less inexperienced people in the door to provide those services. Who's the messenger? And so relying more on those credible messengers, on those family navigators. So, my response generally, and this is an important question, I think, not just about services, but just about case challenges, is if public safety is not at imminent risk, then I think the answer is to keep trying. Is not to just say, well, let's have the juvenile justice system solve it, or let's go to more sanctions-based approaches that we know from research won't work. We need to really find ways to better communicate, better engage, better partner with youth and families, to think more strategically about the messenger and the mechanism for services, and keep trying until we find something that works. Because families might need a cooling off period. They might need some short-term respite or shelter, but families want to get help, and they want to see their young person succeed. We just have to find the right way to do it.
Thank you. Another question, is kind of a two-parter. What role do you see for students with behavioral health needs? So looking at schools, don't typically really provide services for those with real behavioral health needs. So what can the schools do? And then also on the provider side, are there any recommendations for providers who are looking to provide behavioral health services to students?
Yeah, I mean, there are examples of school and community partnerships specifically around behavioral health. There are states like Connecticut and others that have set up mobile crisis response teams specifically attached to schools that are designed to help identify and address young people with behavioral health services. So that like school community partnership, obviously there needs to be a funding source, but I think there are examples that we can point to in states across the country that have developed those kinds of partnerships. Again, that's challenging right now, given the service capacity challenges and the staffing challenges. But I think developing kind of formal school-based diversion programs have also seen more schools kind of formally investing in restorative practices so that young people who are engaging in more aggressive or other kinds of behavior aren't kind of pushed into an arrest or pushed into the juvenile justice system, but school and community partnerships around mediation, around restorative practices, conflict mediation, and then kind of warm handoffs to service providers. So definitely not easy, but I think there are strategies. And if a service provider has those services, like schools right now would really welcome that. We've done state visits where schools are really struggling to meet even like basic ratios around social workers, school counselors, and so service providers really sitting down at the table and thinking about how to work with, if there are school resource officers and school officials, to design those kinds of behavioral health diversion programs is really important right now.
Thank you. So another question is, what is being done to decrease racial disparity from law enforcement that would prevent the interaction of a young person with the juvenile justice system at all?
Yeah, I mean, it's hard, right? I mean, racial disparities has been a focus of the field for a long time now, and we can see from the data, particularly for Black and American Indian youth, racial disparities have just gotten worse. I think the creation of this prevention system will help. I think there are a lot of well-intentioned law enforcement that when we do listening sessions with law enforcement, what they often say is, we didn't necessarily want to arrest this young person, and even they acknowledge like that's not what they should be spending their time doing on kids who are truant or runaways or disorderly conduct or trespassing or low-level drug offenses. They're just not sure where else to turn. And particularly, unfortunately, in communities of color that are sometimes less resourced, there might be even fewer options. So I do think creating a more robust prevention system, community service system will help. I think more credible messengers and peer and family navigators would help. But we also, as I mentioned, like we need explicit strategies to address racial disparities. Folks have been kind of uncomfortable with that in some places, but just general strategies around diversion, general strategies around prevention, general strategies around training clearly aren't sufficient to address those disparities. And so we need things like diversion and deflection programs specifically for youth of color and Black youth, targeting specific offenses. As an example, we're working with North Dakota, and they have a pilot in one of their communities that is specifically around disorderly conduct that research shows kids of color are particularly arrested for at disproportionate rates, and to try to essentially decriminalize disorderly conduct specifically for kids of color and divert them to restorative practices and other alternatives. So definitely not easy, but I think the starting place is just being much more explicit and intentional that we're doing equity work.
Great. Might try to squeeze one more in here. So looking at inherent disparities in screening tools, this person's wanting to know, how can they be sure that that whatever screening tool that is being used isn't mirroring racial biases that they're trying to prevent?
Yeah, it's an important question, and I know there are concerns about that. I mean, I think first it's have to take a step back and remind ourselves like why these tools in many ways were invented in the first place, which is that research consistently shown that professional judgment by itself was not making good decisions about who's likely to reoffend or their specific needs. But it's important, and this requires resources, but that those tools are both locally validated for your specific population, and that validation is not just a general validation, but is validated for different racial groups, to make sure, as the question implies, that the assessments are not biased against youth of color. And part of that is assessment tools are better when they're not just relying on more static factors like age at first onset of arrest or the number of priors, but where they include more dynamic factors that are about youth and families' needs, their strengths. So finding a local research partner can be really important to help do that kind of validation and make sure that the tools are working for all young people in the same way. Just before we end, just want to share that much of the data that I've shared with folks is available through our website. We recently shared a number of resources over the last couple of weeks that jurisdictions can access to show more detailed data trends as well as more effective responses. And also wanted to mention that we are engaging in the next phase of work, which includes the opportunity for one-day improving outcomes for youth site visits with states to educate state policymakers on this data and to really push them to develop a comprehensive plan to address youth behavioral health, violence prevention, and youth development needs. And folks can feel free to contact me directly if they are interested in learning more about those resources or our work. Thank you all for your time and appreciate your commitment to this important work.
Thanks, everyone. Bye.